SKN, millions of people around the world suffer from a form of mental illness. Despite this fact, there is still a lot of stigma surrounding the topic. In an effort to destigmatize mental illness, we will be speaking with consultant, psychiatrist, and addiction specialist, Dr. Sharon Halliday. Good morning, Dr. Halliday, and welcome to Good Morning SKN.
Good morning.
Morning, Doctor.
How are you doing this morning?
I'm great and wishing I was in SKN in the sunshine.
Oh, well, you know, you can always come home. You can always come home. We will welcome you. So as we begin this morning, we will start with your roles and responsibilities as a psychiatrist.
A psychiatrist is a medical doctor who is responsible, who has done 4 years of training after the initial medical degree, and who's responsible for assessing through patients and coming up with diagnosis through interviews, observation tests, medical history reviews, interviewing collateral sources of information such as family members and community members where possible without violating privacy in order to develop a complete diagnostic assessment and treatment planning for the patient to be able to give them the best possible course of outcome.
Dr. Halliday, you just share with us the responsibilities of a psychiatrist. Could you share with us the responsibilities of an addiction specialist?
An addiction specialist functions similarly. We interview patients, we come up with their diagnosis, and we work with them on a treatment plan more targeted towards the substance use. In many instances, lots of clients are dual diagnosed, and sometimes the substance use comes before the mental health disorder, and sometimes the mental health disorder comes before the substance use. But it's in those instances, we have to find which level of care is most suited for the client, whether as an outpatient or an inpatient or in a residential facility. It just depends on, at the end of the assessment, what is found.
Okay. Do you think both has some form of relation to the other?
Yes, both are very related, and oftentimes there's much difficulty in deciding which started first, because many people who have mental health disorders, because of stigma and prejudice and discrimination, they don't seek care from the mental health services. So their first line of defense is to use substances to medicate themselves. Many people who are depressed, they seek to drink alcohol or smoke marijuana to see if that would help them with their depression or anxiety, and that simply worsens the situation.
Wow.
Certainly. And Dr. Halliday, can you tell us how long have you been working in this field?
I've been working in this field since before 2000, but I became an official psychiatrist in 2005 when I finished the Doctor of Medicine in Psychiatry.
Congrats.
Okay. Is this a career you always wanted to do?
Yes, I always wanted to do it, and I realized during medical school that it was the neglected profession. Many people didn't want to do it, even among the professionals. Most people didn't want to be psychiatrists, and I thought it was very much needed. As I worked and did rotations, I realized that the diabetic blood sugars were higher because they were stressed and nobody was dealing with the depression. That persons who had heart attack and stroke, that they were depressed, and that worsened their prognosis. I also realized that many medical conditions such as thyroid disease, chronic fatigue syndrome, vitamin D deficiency, vitamin B deficiency can all mimic mental health conditions. So it's very important that mental health assessments are done on persons.
Wow.
Interesting.
Something so simple, but it's so serious.
It is. So, Dr. Halliday, if someone suffers from, let's say, depression or anxiety, is that a form of mental illness?
Yes, it's a form of mental health disorders. And mental health disorders, there are just simply so many mental health disorders. Even sleep disturbance is an issue that something could be going mentally wrong. And lots of people, they seek to just find sleep. But lack of sleep can be a sign of anxiety, can be a sign of depression, it can be a sign of PTSD, it can be a sign of bipolar, it can be a sign of schizophrenia, it can be a sign of even sleep apnea or something physically wrong. So not sleeping is a symptom that something is wrong. And when somebody's not sleeping, they should be properly assessed and not just seek medication to help them to sleep.
Wow, I cannot believe that so many simple things are associated with mental health.
Indeed.
Wow. Okay, Dr. Halliday, we have been speaking about mental illness. What would you say is the scientific definition for it?
The scientific or the definition for mental health disorders are disorders where you have changes. It's characterized by disruption or changes in appearance, in behavior, in emotions, in feelings, in mood and affect, in perception, in social interaction, in thinking and cognition and memory, which result in significant distress and impairment or problems in social, occupational, and relational and spiritual functioning.
Wow, that's a lot.
So it's a vast group of disorders, and you recognize it by people simply by changing appearance. If somebody is manic, they might start wearing flamboyant colors. If they are becoming schizophrenic or disorganized, you may notice that they're not bathing or changing their clothes. If they are becoming manic, you'll notice that they're laughing or they're spending extra money. If they are depressed, they'll be withdrawn and isolated.
Interesting.
And of course, the emotions. If you are depressed, you will feel sad, you will feel neglected, unwanted, you'll have low self-esteem, your mood will be depressed. If you are manic, you'll be laughing and giggling, or you might be extremely irritable. If you have PTSD, you would have hypervigilance and avoidance of trauma and avoidance of situations. And of course, the perceptions, which is what frightens everyone, is the disturbance in your five senses, where you're seeing things that are not there, hearing things that are not there, smelling things that are not there, feeling things that are not there, and tasting things that are not there. So you have 5 different types of hallucinations, which are disturbance of perceptions that often are the most disturbing for people, and perhaps what brings the most attention to the mentally ill.
Before we continue, you mentioned PTSD. I know that's normally associated with soldiers. Are they the only persons that are affected, or a normal individual who is not in the armed forces? Can they be affected with PTSD as well?
Everybody in society is affected by some sort of trauma. And in fact, undiagnosed trauma, especially in children, and adverse childhood events, especially in children, can lead to a lot of mental conditions. And in fact, what they are realizing is that early trauma or trauma to children actually changes the DNA. Not only does it change the brain and the stress response, but it actually changes the DNA. And that person may be forever tainted in terms of the way they are able to respond to trauma and to have usual life events. From domestic violence to abuse of children. And children can be abused indirectly by exposure. Simply a child watching television with an adult, they're seeing things that they should not see, could permanently traumatize a child. You have children who are just totally neglected. You have children who are verbally abused, physically abused, sexually abused. I mean, the gamut of abuse in society is just great. There's so much trauma in society. And one of the first things we do when we get a patient to assess them is we look at the trauma history. And invariably, there's some sort of trauma, there's some sort of illicit touching, there's some sort of conversation where the child felt outcast or ostracized. The bullying that goes on in today's society, especially with cyberbullying and internet bullying. And, you know, that trauma is just a very important cause of mental disorders.
Wow.
Indeed. Dr. Halliday, personally, I find myself sometimes talk to myself. Do you think talking to yourself can be categorized as being a form of mental illness?
talking to yourself should not be categorized as mental illness without a complete assessment being done. If you talk to yourself because you like to talk aloud and hear, I mean, my students are studying, it's good to talk aloud for reinforcement. More importantly, if it's you hear others talking to you, or if you're talking to yourself and somebody else is answering back, then you really should.
There you go. I'm happy the professional to clear that.
Thoughts aloud can be good, and of course, praying aloud and reasoning with yourself is acceptable. But if you have any doubt as to your mental state, then you should, of course, seek assessment and help. Many people, everybody goes for annual checkups.
Yes.
Everybody goes to the dentist. Everybody goes to their cars are reevaluated every year and so on. But people do not go to do their annual visit at the psychiatrist to see if they are well. So I'm recommending annual psychiatric visits going forward for everyone.
We know that's a problem, Dr. Halliday. How can we break the stigma to get us, as you said, to just come in yearly and really check and take care and prevent any damage that may happen to our mental health? How can we break the stigma?
I think if people really, we just have to continue with education. And I think if people really understood that they didn't cause a mental health disorder, and the causes of mental health disorder are biological, psychological, social, and spiritual, cultural. So if it's in your family, genetics, gender, they're more likely to occur in, certain disorders are more likely to occur in male or female, using drugs. And sometimes it's the medication that the doctor gives you. Chronic illnesses, hypo and hypothyroidism, certain cancers, certain seizures, asthma, certain medication like steroids and certain stimulants can cause the psychiatric disorders. Sleep deprivation. I just had a client who stayed up about 3 nights worrying about being able to meet their financial needs, and they ended up in the psychiatric unit. So sleep deprivation is a big cause, and lots of people are not sleeping. Social media and television has wreaked havoc on the lives of people because they're up on social media, they're not sleeping, they're not getting adequate rest. That is depleting the natural neurotransmitters in the brain and is causing people to have more on mental health disorders. Unhealthy diets can affect the way you process. Lack of the appropriate building blocks for the amino acids that make the neurotransmitters for your brain is important. Head injury from whether riding too fast or whatever, footballers, any thought of head trauma can affect. Toxins in the environment can cause mental health issues, heavy metals. Even sometimes what happens in the prenatal, perinatal period, whether your mother was sick, whether you required oxygen at birth, whether you were premature, whether you had birth trauma and precipitous labor and delivery. You have febrile seizures, meningitis. I mean, the list for biological causes for mental health disorders goes on. Lack of exercise, because people don't exercise, can cause obesity and low self-esteem and depression. Then, of course, we have the psychological causes of the early childhood trauma, broken mother and child bonding with children in foster care system, rejection, abandonment, neglect, isolation. All of these things cause mental health disorder from a psychological level. Simply not learning to cope, poor coping skills, negative thinking, pessimistic thinking, catastrophic thinking, being stuck in a particular phase of development can cause mental health problems. And then the reality of life, when external things happen, you know, you lose a job, you lose a house, you lose the finances, you lose a partner, natural disasters and floods and earthquakes and trauma, you know, externally. And the well-known story, if you were Job, if we look at in the Bible and we use a spiritual context, look at Job. Job lost in basically a few seconds. And while he was yet speaking, and while they were yet speaking, and while they were yet speaking, and while they were yet speaking, 5 different episodes of bad information in one blow can cause somebody to be totally derailed. So you may wake up today, and by the end of the day, you've had so many losses you are on the mental health unit in the next day.
Wow.
Interesting.
So I think if people understand that it can happen to anybody because we don't know what life holds, they'll begin to be more sympathetic and empathetic with persons who have mental health disorders.
Exactly.
And Dr. Halliday, can you share with us some of the types of treatment and care and support of patients with mental illness?
Yes. Mental health disorders, the treatment is very simple. So we said the causes are biological, psychological, social, and spiritual. So one of the causes, and I'll continue, lack of prayer and being filled with the Holy Ghost and not worshiping God. That can also result in mental illness because prayer and worship is one way of dealing with stress. So the treatment mimics the causes. Treatment mimics cause. If the causes are biological, psychological, social, and spiritual culture, the treatment must, of course, be biological, psychological, social, and spiritual. So biological, one thing we said, you need rest. So get rest, exercise, the appropriate diets and nutrients. Then, of course, we have the medication that we can put you on, which when we finish your assessments, we'll determine if you need antidepressants or mood stabilizers or antipsychotics or beta blockers or antihistamines. And there's a hormone replacement, and there's a wide gamut of medications that we can use. But there's also light therapy, and there is also other therapies such as equine therapy and other therapies that would help. And of course, exercising, eating healthy balance, breathing in natural air, vitamin D being out in the sun, replacement of vitamins, etc. Then, of course, there are the psychological treatment, which are very vast in number, based on the various psychotherapies. But of course, learning to problem solve, learning to have positive self-talk, avoiding negative self-talk, avoiding the news, avoiding negative movies and persons, finding your purpose, exploring your creativity, doing things that bring you joy, doing things that are positive, doing gainful mindfulness, progressive muscle relaxation, using guided imagery. All of these can really definitely affect you. If you go to see your psychotherapist, they would do, the cognitive behavior therapist, the trauma-focused therapy, dialectical behavior therapy, person-centered therapy, supportive therapy, and many different types of psychotherapies that are available.
Awesome.
And then also fixing the external. Fixing the external, getting a job is going to help. If you are depressed because you lost your job, finding a new partner if you had lost your partner. Time management may also help you, and anger management and conflict resolution. All of these things would fix the external things that are wrong with you. And of course, if drugs is a problem, you have to stop using drugs and you have to be rehabilitated from your substance use. And we said spiritual, so going to church, Bible activities, prayer, singing and dancing, and reading the word of God and being filled with the Holy Ghost will, of course, help you.
Interesting. Dr. Halliday, we want to thank you so much for sharing with us your expertise with us this morning. But as we go, can you just share with us any words of encouragement for anyone out there who might be listening and suffering from mental illness? Any form of encouragement for that individual?
The words of encouragement are that you can be helped. Most people didn't bring the disorder on themselves. There's lots of good help. There's help in the Federation. The government has many psychiatric clinics. You can contact the Bastel Center, Sandy Point Health Center. There's the Council Health Center at Wade's Garden. There are other persons working privately. You can contact medical associates for an appointment to see me. You can also, if you can just build resilience. Resilience means that you put money in the bank. Lots of us are not putting money in the bank in terms of our mental wellness. If you can make sure that you're relaxing, if you can make sure that you are having good, healthy, clean recreation where you laugh if you make sure that you are refueling your body, which is adequate rest, nutrients, hydration, vitamins, taking your medicine as prescribed, building supportive relationships. Lots of people spend time breaking down their relationships. Your relationships are very, very important for you to have support during your times of distress in life. If you can do reflection and see where you are, and once you think that something is not right, get help. There's help out there. You don't have to be stigmatized. You don't have to be discriminated against. Yes. I treat many people. They have very good jobs, and they do what they're supposed to do with the biological, psychological, social, spiritual approach to mental health. It's a disorder like any other, and people can do well with this illness. And finally, it is an illness that won't kill you. I've worked in mental hospitals in Jamaica. People were in there 120 years old. If you get cancer, if you get AIDS, if you get something else, you'll be taken out way before you're taken out if you get a mental health disorder. You can live a long, satisfying life, well treated, well controlled with your mental health disorder.
President